Today I am here to demonstrate the examination of the right knee joint. I have taken the clinical history from the patient. Now I will do the examination. I have taken the consent from the patient for doing this video examination and use it for this course. And now I will go, first of all, I will go for the posture and the gait. Do like this. So, now stand. Do like this. Patient is standing on both the lower limbs alternatively, and is standing with the shoulders on both the sides equal. And now I will go for the gait. एक बार चल के देखो. अब वापस आओ. तेजी से चलो, थोड़ा सा 2-3 बार चलो ऐसे. Patient is walking normally without any pain, without any limping, and there is no click sound present. कुछ अंदर से आवाज तो नहीं आ रही है. There is no click present, and the patient, the knee is moving freely at the swing phase, and the patient is knee is completely straightened out while walking, and the foot is planted completely on the floor while walking. Now I will go for the inspection. In the standing position, in the lying down position, and in the sitting position. First of all, I will do the inspection in the standing position. In the standing position, from the front, both the knees are symmetrical. There is no deformity seen, no swelling present, and there is no wasting of the quadriceps muscle, and the patella appears to be present centrally. And there is no scar mark present, no bruise present for any injury marks, and suprapatellar pouch and the infrapatellar pouch are free. Now I will do the inspection from the back. In the inspection from the back, there is no muscle wasting seen, no swelling present, no scar mark present, no bruise present, and there is no deformity seen from the back. In the sitting position, the patella is located centrally. It is not located higher or lower down, and not on the lateral side, not on the medial side, on both the sides, and there is no wasting. Now I will do the inspection in sitting down in the lying down posture of the right knee. There is no wasting seen. The quadriceps is symmetrical on both the sides. Suprapatellar pouch and the infrapatellar pouch are free, and no scar mark, no bruise, any marks present, and there is no deformity present, and both the knees are straightened out without any extension left. Now I will inspect the knee on the prone position. On the prone position, there is no deformity seen, no wasting of the hamstring seen, no swelling, no scar mark seen. Now I will go for the palpation to confirm my inspectory findings, and I will examine both the knees simultaneously one by one, and will compare both the knees. On palpation, there is no tenderness present in the suprapatellar pouch, no tenderness present on the medial joint line, no tenderness present over the patellar tendon, tibial tuberosity, lateral joint line, both the femoral condyles and both the tibial condyles, in comparison to the left knee. And there is no bony prominences felt on both the knees. Now I will examine for the patella. I will try to touch the under surface of the patellar joint. I am pushing the patella on the medial side and try to lift off the patella, and I am touching this under surface of the patella, and there is no pain. Now I will do it again with the patella pushed laterally and try to touch the under surface of the patella. If there is any gritty sensation, it shows the chondromalacia patellae. I have compared on both the sides are the same, and then I am doing the test for the patella grinding test. I am pushing the patella on the femoral condyle. Any pain? There is no pain on both the sides, and there is no gritty sensation or any crepitus present. Now I will ask the patient to move the knee. There is no patellar crepitus fetus field, that means there is no chondromalacia patella. Now I will ask the patient for the range of motion of the knee. There is complete range of motion of the knee. Movement of the knee is free, without any click, without any pain. And now I will go for the apprehension test. I am pushing the patella laterally, and now I will try to flex the knee. If the patient resists for this movement, then the test is positive. In this case, the test is negative. Now I will go for the instability test for the medial collateral, for the collateral ligaments, for the cruciate ligaments, and for the meniscus. For the collateral ligaments, I will test for the valgus stress test and the varus test. These collateral ligament tests I will done in the complete extension as well as in the 30° of flexion. If the 30° of flexion is positive, I will demonstrate this test. Now first of all, I will do it 30° of the flexion. I will hold the leg. I will hold the distal tibia, distal leg, and my hand is on the back of the knee and completely holding the knee. Now I will give the valgus stress. I am giving the valgus stress. There is no opening of the joint, and I am giving the varus stress. Likewise, I will do it here. There is no opening of the joint in comparison to the other side. Now I will do in the extension. This is varus, valgus, this is valgus, and this is varus. And there is no opening of the joint. If there is opening of the joint on the 30° flexion on the valgus, this is the indicative of the medial collateral ligament injury. Even if there is no opening up, only pain is there, this shows there is a sprain of the medial collateral ligament. Similarly, if the lateral side is opening up more than 5 mm as compared to the other side, or there is any pain, this shows the lateral collateral ligament injury in varus stress test. If it is in the extension, valgus stress test is positive. This shows there is a medial collateral ligament injury as well as there is an injury to the ACL and the injury to the posterolateral complex. Now I will go for the cruciate ligament injuries. First of all, I will do for the anterior cruciate ligament injury. Anterior cruciate ligament injury is very common in the sports, and usually the patients gave history of the instability while running, while brisk walking, and they say my knee will give way while running and I will fall down. And most of these patients present with the repeated falls. And now in the anterior cruciate ligament, there are 2 tests. First is the Latchman test, which is more sensitive for the anterior cruciate ligament injury. Another is the anterior draw test. Now first of all, I will go for the Latchman test. The Latchman test is done in the 10 degrees of the flexion. I have holded the distal thigh with one of my hand, and another hand I put on the proximal tibia. Now I will stabilize the thigh with my hand and try to push the tibia up. Try to push the tibia. There is no laxity here. Now I will do it on the another side. There is no laxity here. That means anterior cruciate ligament is normal. This test is more sensitive for the anterior cruciate ligament. Now I will do the test. Come here. Now I will do the test in flexion. In the flexion, we can see the down slope of the proximal tibia. If it is down as compared to this, then it shows that there is a posterior cruciate ligament injury. Now I will do the test for the anterior cruciate. I have kept my both the hands on the fingers on the posterior aspect of the knee, and both the thumbs are anteriorly towards the patellar tendon. My fingers are relaxing and checking that whether the hamstrings are relaxed or not. Now I will put the tibia outward. I will put the tibia outward. If it comes out, and I will also do on this side. If it is more than 5 mm as compared to the other side, it shows the test is positive. And now I will push it backwards. I will try to push it backwards. In the backwards, if it goes backwards as compared to another side, this shows that there is a posterior collateral ligament injury. Now I will do the test. Another test is for the pivot shift. If the pivot shift comes out to be positive, then in addition to the anterior cruciate ligament injury, there is an injury to the lateral collateral ligament as well as to the posterolateral complex. Only then the pivot shift is positive. And I am going to demonstrate the pivot shift in this test. I will keep my hand on the foot and will internally rotate the limb, and then I will put my another hand on the proximal leg and try to give the valgus stress on this leg. And will go on flexing the knee slowly. If there is any give way sensation, that means the test is positive. In this, the test is negative. Now I will go for the test of the menisci. In the menisci, the test is most common test we do is the McMurray's test. In the McMurray's test for both the medial and the lateral one, I will flex the knee completely, and then external. One my hand is on the knee and another on the foot. Then I will externally rotate it and give the adduction force to the knee, and then try to extend the knee. If there is any pain or any click in the joint, then this shows that there is the injury to the medial collateral ligament, medial meniscus, and it depends. If it comes in the initial range, then it is the posterior horn tear. If it comes in the middle range, then it is the middle horn tear. And similarly, I will go for the lateral meniscal tear. I will internally rotate it and adduct the limb, and then do the extension slowly. If there is any pain in the click, then this shows that there is a lateral collateral ligament, lateral meniscal injury. And sometimes the click can also be found in the discoid meniscus, which are usually on the lateral side. And I will do the test on this leg also. In this, the test is for negative on both the sides. We'll do it. Now I am going to do the Apple's grinding test. In Apple's grinding test, one hand is stabilizing the knee, and with another hand I am doing the external and the internal rotation. If there is any pain on the external rotation, this shows medial meniscus injury. If there is any pain on the internal rotation, this shows lateral meniscal injury. Now these are the tests for the instability of the knee joints. Now in any problem of the knee, we have to examine the hip also, because sometimes the pain is referred to the knee from the hip joint. I will see for the tenderness in the hip joint, and I will see the range of motion in the hip joint. First of all, I will do the tenderness anteriorly. Is there any pain? This is the lateral tenderness, and now I will check for the range of motion. Range of motion of the hip is normal, and there is no tenderness present in the hip. Now the hip is okay. Knee I have examined. Now this is all for the knee examination.